I am now going to pass it back to Sandra to close out our workshop. Thanks so much.
Thank you, Sarah, for leading us through that. This is a bit overwhelming to close out this workshop. It has been incredibly stimulating 2 days with just wonderful panelists, moderators, and you, the participants. So first, let me start by just thanking all of you for being with us and sharing your experience, your guidance, your wishes for the future. And I have to obviously just say thank you to Robin Solar and Joanna Andreas at CDC and the Center for Preparedness and Response, because without them, we would not be having this. So thank you so much. Where to start? Let me just say that, we know that from all of our panelists yesterday and today, that we have a lot of work to do yet, and many of you are doing innovative things to expand our ability to make science accessible and available to our publics. We have some things to learn in terms of how do we make really simple, direct recommendations. And then what do we need to know about how we get people to change and adopt, the things we may need them to do in an emergency. We recognize that there's a public, there is an information overload challenge, and that, we may have multiple public health officials and others communicating all at the same time, and that presents enormous challenges. But we also hear some really interesting new sort of strategies and research being done about how do we address misinformation, disinformation that, may prove promising for us moving forward. One of the things we heard, and I remember this in the anthrax study I did after that attack, funded by CDC, and it came up repeatedly in the last 2 days, is the tension between science, which often moves slowly, it's complex, takes time, and the need to communicate quickly in an emergency. That's an ongoing tension, and that we need to do a better job at helping our communities, our publics, and our partners understand uncertainty is real, the science will evolve, we can expect change in our guidance. That doesn't mean we were wrong. So we also recognize, and Dr. Osterholm brought up this point, that the public health, we ourselves can sometimes be responsible for some of the challenges that the public has in understanding what we want them to do. We often speak with different voices. We saw it yesterday with the authorization of the vaccines for a second booster, and then others saying, well, we're not sure that's needed. So, we can make our own mistakes, get in our own way by often not being on the same page. But the other thing that came up in some of the sessions was, to what extent do we trust the public to handle the truth? And can we trust that? And I think Marion and I can't remember who else did this, but talked about the issue years ago that we thought the public would always panic, when when emergencies occurred. So can we trust the public with learning the truth and being honest with them in the midst of an emergency? I think it's an ongoing area in which we will need to work. One of the other things that came up around the misinformation and disinformation discussion and the information environment is, obviously, this is changing literally as we speak today, right? And it is an area, especially dealing with social media, that most public health agencies just simply do not have the resources to really address some of the complexities of dealing in that world. But we may be able to also learn from some other sectors that are working in this arena. And it could be social marketing, it could be other agencies that are working in this arena to address misinformation, to develop new platforms. We heard some about using games as a way to help inoculate the public against misinformation and disinformation. So, I call for some new partners in that arena. One of the challenges I think that many of us have talked about for a long time is the ability to draw upon the research we need in an emergency, whether it's a pandemic and we need to understand, why even when our communication's good, don't some people take the vaccine? But it's also, how do we get people to respond to other kinds of emergencies? What can we learn from the literature around warnings for disasters, wildfires? And we heard from some of our colleagues that work on natural disasters, our fire chief. And so how do we begin to pull together the research, the frameworks, the models that can help inform our communication, our ability to build trust and to become more trustworthy? And that indeed is another area that is important, is what kind of research can we draw upon? What do we need to understand what are the characteristics of trustworthy public health agencies? What do we need to do to ensure that our science is trustworthy, and what our actions are? How do we look at our own actions as agencies to understand where we can make improvements to improve our trustworthiness? We need, Monica said this earlier, longitudinal research is very rare in the context of a crisis, whatever type it is. And it's really critical to helping us understand how publics react, but also how things change over time with our communities. We heard earlier today also about the need for dissemination and implementation work. And I'm going to add on to that, really building in the capacity in our public health agencies for solid program evaluation. One of the things the original committee on Pepper evidence base talked about was, where is our evidence base on public health preparedness and response? What are some of the challenges that we have? This is a perfect moment to go back and say, what are we learning this time? And remembering this time is not just the pandemic, but it's the wildfires across the West. It is the extreme weather and tornadoes and floods, etc., across much of the country. What are we learning today, and how do we better capture that to inform, where we need to go next? Which brings me to infrastructure. We heard a lot in this last session in the Marrow Board about the need for staff that looks like the America we are today, staff that are trained in crisis and emergency risk communication, staff that are trained in new methods of data surveillance, staff that know how to engage with communities. We can't assume that everyone has that capacity. So we have a real need for, and we just heard this in the session, training and training and training. But I'm going to bring in a couple of other groups that need training as well. One is scientists. So how do we help our researchers become more comfortable with speaking to the evolution of our science and being able to provide guidance to public health agencies when they may not normally be ready to do that, but we can't wait in most emergencies. But I'm also going to say that it's, to do all that and to do the exercising, to do the planning we've heard about, to do the development of community relationships takes sustained funding. Too many local health departments rely a lot on grant funding and funding that is episodic, and they cannot do what we need to do. I would be remiss if I didn't come back to community and community. And there's such diversity in our communities, even within racial group, within ethnic group. There's such diversity across our country and in our jurisdictions. And that building those partnerships doesn't start the day the pandemic occurs, right? It is a long-term effort. And again, it goes back to, do we have the infrastructure and the funding to engage with and build a cadre of community ambassadors, promotores, community health workers that really can reach out in ways that we may not be able to. But can we do that also in a way that helps us plan, helps us evaluate what we're doing, and helps us develop much stronger trust? And that's critical. Community will be part of any emergency we deal with. And building the science around that community engagement and building the capacity to engage is essential. But I'm also going to come back to something that we've heard throughout, and it came across particularly today to me, and that was recognizing our own humanity. That to build trust and to be trustworthy means that we need to be also human. We need to have empathy. We need to be able to be honest, what we know, what we don't know. One of the things Mike Osterholm says on his podcast all the time is, I'm humbled. Again and again. What don't we know at the start of any emergency? And it's usually more than what we know, right? So the need to really prepare ourselves to be honest, to be humble, and to be open, and recognize that communication is not messaging. Communication is a two-way process of listening, engaging, developing communication tools, having our community partners look at them, provide feedback, and tailoring them to communities in ways that make sense for our diverse communities. So I'm going to stop in a moment, but I want to leave you with this question before we turn to our colleague from CDC and say, yesterday, one of the questions that was raised was, are we going to continue to be transactional in how we work with communities, how we do how we respond to emergency? Are we going to take this moment to think about transformation? Take the resources. Monica's always on top of what's happening with Congress and potential legislation, and use those resources wisely to transform and build trust and become more trustworthy so that our science, our pepper science, actually makes a greater difference in future emergencies than sometimes it has in our past. So that is our challenge, right? So I'll just take a moment to remind you of a couple of things. We will have a proceedings document in about 3 months. And so, we will get that out and watch for that. If you have comments, suggestions, questions, please feel free to reach out to the Academy staff. They are there, and we know we've stimulated a lot of discussion.